So you have like CF clinics like every, like for me when I go like every Monday, like every 3 months.
Yeah.
There's CF clinics. So does that mean that all of the CF kids are going in that day? Like, and how do you like separate it? Because it is contagious within other CF people.
Right.
So how do you maintain the distance or like?
Yeah, that's a great question. So how do we keep patients safe, but also have them see all the people they need to see? So what we do is we try and organize things so that our patients don't have to come a bunch of days to see a bunch of different people. So on our cystic fibrosis clinic day, what we do is they see the doctor, they see a social worker, they see a dietitian, they see a respiratory therapist, they see a nurse, and that's a bunch of people all at once. And so usually we do that on Mondays. And but at the same time, what we talked about with germs, we don't want them sharing germs. So the way we do it here is when a patient with cystic fibrosis uses a room, like this room right here, we close it off for the rest of the day. For all cystic fibrosis patients.
So other people could come in here, but just not CF.
Yeah, and technically we don't even let other people use it, but mainly it's for the other cystic fibrosis patients. And then at the end of the day, we wipe down the room to get rid of the germs, and we also know that the germs, they're not made to like sit on the table, so they just sort of die out. So by the next day, they're pretty much dead anyways, but we do definitely wipe it down. So what we do is we have the boys and girls and young men and women with cystic fibrosis, they come into the room so they don't have to wait in the lobby, because we don't want them sitting next to somebody else and maybe catching somebody else's germs. And then they come directly into the room, and then once the room is used by that patient, we shut it down for the rest of the day so that the next patient doesn't come in and maybe catch something from just being in the same room.
Okay.
Yeah. It's sort of a big deal because in the